and it comes with a lot of complications, especially if the child is admitted because of severe illness. We may lose some, and some have died. And we also have those who will end up with complications, such as meningitis, losing sight, losing the hearing, and other complications. But for the typhoid, we know that for our hygiene practices and also for food safety and sanitation, including the water that we take and the water being contaminated, and also the way we handle our food, we also have cases of not only children, but people suffering for typhoid. And why we are introducing this vaccine to children is because we have seen a very big rise in resistance to antibiotic. That is the antimicrobial resistance. So we do not want our children to be exposed to typhoid, yet we know that there's a lot of resistance to different antibiotics, which means that if a child gets the typhoid, then they need to get very high type of antibiotics to treat them at a tender age.
All right, but parents have lots of concerns. Many feel that this vaccination drive has been rushed. So is the vaccine safe, and what should parents expect when their child gets the jab?
We already know that the vaccine is safe because it has been given a go-ahead by the World Health Organization, and through Ministry of Health, they also assigned that this vaccine is safe. And the typhoid vaccine is not very new, but it is being newly introduced into the routine vaccine space. So typhoid vaccine has been there, but now because of the incidences of children who get typhoid and even adults who get the typhoid, it is good for us to protect our children because we know that they might suffer a very serious disease. So it's not a relatively new vaccine in the space, but it is being introduced into our routine vaccination. Then for the measles, we know that over a period of time, we've not reached the coverage that is needed at 90 and above for all vaccinations. We find that we are, especially after the COVID pandemic, most of the children have not reached getting their doses for measles. And we know as much as the measles 1, because the doses that children get is the measles 1 at 9 months and also measles 2 at 18 months. The coverages are also not reaching the coverage that is expected in the country. And we find that every year when we look at our reports and our data, we find that 15% of the children have not gotten these vaccines. So cumulatively, if you look at children who will not get maybe within 3 years, it goes to 45%, which means these children could be exposed to measles if there is an outbreak. And we have seen that, I've said previously that we have reported the measles outbreak in counties within Kenya. So when this happens as a response to stop further outbreak and also to see that the children who get the measles will not get severe disease, then we need to come with a strategy of getting the vaccination. So we have had these vaccinations ongoing. It's not the first time that we are giving the measles campaign. We've done that. Remember, in 2016 we did it, in 2018 we did it, but because of the COVID pandemic, we were not able to follow the sequencing of every 3 years. For the typhoid vaccine, I know if you look at social media, people are saying this is new. If we go to the private hospitals and we go to sites where they are allowed to give vaccines, in facilities that just deliver vaccines, we find that it has been there. So it is not relatively new. So what we are trying to make as the health promotion department people understand, and even through our CHVs who are going to the household, it is that we are introducing the typhoid vaccine into the routine space so that the children will be getting the typhoid vaccine as one of the vaccines that they get at childhood. All
right. And there's been a lot of skepticism from parents, of course, many even feeling that their children have had too many vaccinations, especially post-COVID-19. What would you say to those parents?
We know that we are having a lot of emerging and re-emerging of these communicable diseases, and we need to put stopgap measures for children not to get these illnesses. We know that when children are born, they don't have the immunity. And before they get exposed to a disease, they better be prevented. We can all imagine if your child gets measles today, first of all, as a mother, you have to dedicate your time. as a parent, even a male parent, you have to dedicate your time. Maybe the child gets hospitalized, you'll use your financial resources. Emotionally, it drains. Psychologically, it strains. So it goes with a lot of other effects to the family, psychologically, financially, maybe even just emotionally. So for this burden to be reduced, we need to look at that. And then as children get ill or any of us gets ill, we are reducing the budgets maybe for the family, maybe even for draining the resources for healthcare as a nation, as a county. So prevention is always better than cure. When you prevent, you use lesser resources than when you are curing.
All right. Now, you mentioned that some counties have as low as 45% coverage, vaccination coverage. Let's talk about Nairobi. What is Nairobi's current vaccination coverage, and which counties or sub-counties in Nairobi worry you the most?
We are looking at 85% coverage, but when we look at this, it is not all sub-counties that are at that par, because we know that maybe in one sub-county you'll find that the measles one is doing very well, the measles two not doing very well. You'll find that others have not attained the third, maybe the third polio and the other accompanying vaccination that go with it. That is at 14 weeks, because they have the sequence that the vaccines are introduced. The first one at birth, then at 6 weeks, at 10 weeks, and at 14 weeks. Then later for the measles at 9 and then at 18. And we also give the deworming and the vitamin A supplementation. So when you look at how we are giving them and the schedules, some children are not going to get them maybe at the regular timing that is needed. So with those gaps, that is how the coverage comes back down.
All right.
So we look at both the utilization of the services, by how many people will come and utilize the services, and also looking at the access to the vaccines. That is how we measure the coverages.
Let's talk about the targets that you have. I mean, we're talking about millions of children. How are you ensuring that every child, especially in informal settlements, is identified and vaccinated?
We are not only looking at informal settlements. This is a reach to all children in Kenya between 9 months up to 14 years. So for the ones who are getting measles, they are getting between 9 months to 59 months. For those who are getting the typhoid vaccine, they are getting between 9 months to 14 years. So the strategies that we are using, one is that we are going to the communities and setting up temporary fixed points. So if it is within a village or a ward, we mobilize through our community health promoters, through the religious leaders, through the officials of the government, and other decision makers in the community. First of all, to tell people that this is happening, and we enter a dialogue with the communities. Like if it is a school, we ask for entry, and they will tell us which day we are supposed to go to that school, and they will have informed the parents. So the parents are informed of the exercise, and they give us a leeway. The same to the religious institutions, not only the churches. We are going to the churches, to the mosques, and to the temples. So we arrange that with the leadership in that religious institution, and they give the information to the parents, and we are able to access the children. Then for the communities, we are having what I've said, the temporary fixed points, where we go and put up mini outreach where the children now come.
All right. All right. As we wind up, Lillian, to that parent who is still watching with hesitation tonight, what is your message to them, and why should they trust this campaign?
We should say that now we are only giving this as a supplementary vaccine for the measles, so that we can make sure that our children are protected. For the typhoid, we are introducing, and we are not only giving at this campaign, but it is going to be introduced as one of the vaccines that we get within our clinics, whether it be a public facility, a faith-based facility, or a private facility. So we encourage all the parents to come forth, and if you have maybe any inquiries to make or information that you really want to get, you can visit your healthcare provider. You can reach the nearest health facility to get this information. Or for those who are out of Nairobi, you can call still the same number that we used for COVID, 719, ask for more information from Ministry of Health. Here in Nairobi, we are using 1508, which is the number for Nairobi County.
All right. Lillian, thank you so much for your time. And Lillian Mutua is the head of health promotion at the Nairobi Nairobi County Government, speaking to us about the integrated national vaccination drive, which was launched today by Health Cabinet Secretary Aden Duale, assuring parents that the vaccine is safe. Let's take a short break here on NTV Weekend Edition. Stay with us. Sports news still to come.
Good morning, Babu.
Hey, welcome. Have some chai. Have some cereal. You know, breakfast is the most important meal of the day.
Oh, I know, Babu. I have my cereal right here. I'm all about the oats. In fact, you should try Pillows. It's lighter and healthier.
Babu has been eating the same cereal for the last 40 years.